Doctor, I have a sore throat. Having a sore throat is among the most common reasons to visit your doctor. There are numerous causes, but most commonly viral illnesses, strep throat, or other things such as dry winter environment, acid reflux, a runny nose, allergies. Those are all possibilities. In this short video, we'll talk about testing and treatment. We'll give you some tips on how to save potentially a significant amount of money at your next clinic visit. So how do doctors know if a patient has strep? There are certain criteria that can be used to help predict whether a patient might have strep. Knowing this inside knowledge may save you the cost of a strep test. Patients often want to know, can't I just get an antibiotic? Well, if it's a virus, an antibiotic's not going to do anything for you. It may give you side effects. It's certainly going to waste your money, and it also contributes to antibiotic resistance. Testing, that's something to discuss with your provider. Not every patient needs to have a test when they present with a sore throat to the clinic. Center criteria are a list of 4 criteria which help doctors predict whether a patient might have strep throat. The presence of fever, swollen tonsils or tonsils covered with a white matter, which we call exudate, swollen glands under the angle of the jaw, which doctors call adenopathy, and the absence of cough. These 4 factors help predict whether a patient may have strep throat. If less than 2 are present, the risk of infection is very low, probably less than 10%. If 2 to 3 of those symptoms are present, most providers would swab the throat, and if positive, meaning the patient has strep throat, an antibiotic would be prescribed. If greater than 3 points, the risk of strep infection jumps up to greater than 50%. In the right setting, based on what your doctor sees in your throat and perhaps whether you've been exposed to strep or not, you may be able to skip the strep test altogether. That'll save you a significant amount of time and money and move right on to antibiotic treatment. You can see from the cost outlined here that tests are expensive. A rapid strep test at many local clinics costs $42. If that rapid test is negative, most clinics will move on to a follow-up test, either a culture or a strep PCR, which is a more reliable chemical test. That test alone costs $130. So, for example, if you came in with a runny nose, no fever, a cough, probably the chance of strep is fairly low. The rapid strep test plus the strep PCR test, $172 just for that alone. If you don't have insurance, that's a huge cost. Even if you have insurance, and I know this from personal experience with my own family, that not all insurances cover the follow-up test. My child had a strep test. It was negative. Had the follow-up test done, and our portion after insurance was over $92 out of pocket just for the strep test and the follow-up test. Mono's a possibility, cost $24. A CBC, which is a complete blood count, that's $35. If you want the lab to break down the different types of white blood cells present, the cost jumps up to $51. Add on top of that, lab fees. Labs cost or charge $15 to $20 just to draw the blood and process the specimens. As you can see, the total cost can be quite staggering, over $250. Antibiotic choices. There are many common choices for strep throat. Penicillin, amoxicillin, Keflex, all on the $4 list at major retail chain pharmacies. The other choices work well, but the cost is significant. You can see if you didn't have insurance, paying $82.99 out of pocket is prohibitive. Zithromax, that's a good option as well, 5 days, convenient, but the cost difference there is $24.84. What would you like to pay? Viruses will run their course. No antibiotic is needed. Bacterial infections, strep throat, for example, are treated with antibiotics. Your doctor will determine if something else is causing your sore throat. Always let your doctor know if your symptoms are not improving. As you can see from the short video, we have shown you a few simple tips on how to predict whether strep throat might be present or not, discuss some cost-saving measures regarding testing, and given you some reasonable antibiotic options to discuss over with your doctor. Thank you.